We're here at Augusta Health with Brad Johnson, who is the director of the Cancer Center. And Brad, you were just mentioning to me earlier today you were video conferencing with Duke. Tell us about the affiliation with Duke and what that means to people right here in the Shenandoah Valley.
Sure. Well, you referenced the equipment, and we use the video conferencing equipment for quite a few things. Today we used it talking about integrative medicine. So integrative medicine meaning whether it's diet, whether it's exercise, whether it's certain other healthy choices like not smoking, and how do you integrate that with your regular conventional medicine. So we had the experts on, and we were conversing about, again, kind of expanding upon the services we already have and enhancing those services. Another area that we use it about 3 times a month is with a tumor board or a cancer conference, and that's when we bring all of the medical specialties together. So we've got radiologists there looking at x-rays, we've got pathologists there looking at the cells up on the screen. Of course, we've got all the docs involved with cancer care, whether it's a surgeon, a medical oncologist, a radiation oncologist, family practice doctors, subspecialists. And what we do is we discuss that patient's case, and we review kind of from the beginning of patient came and they presented with such and such a symptom. And then we review whatever diagnostic images that they may have. And if they did have a biopsy, we then review that biopsy. Well, we've got Duke on the other end, and we've had both physicians as well as genetic specialists, because there's a genetic component along with cancer there. Doing this kind of in collaboration together. So just because we may not have all the medical specialties here, we have the medical specialties in the room with us when we're discussing that case.
So if I have cancer of some kind and I'm a patient at Augusta Health, there is a chance that my physician, my oncologist, could be sitting in the same room with a specialist of a number of disciplines at Duke discussing my tumor.
Correct. We see a lot of breast cancer, a lot of colorectal cancer, prostate, lung. We may not see a sarcoma, which is it's one of the 100 and some different diseases that we call cancer, but we may have that specialist on the line who may see hundreds of those there at Duke.
And so they would be involved in shaping my care even via teleconference and looking at the same images that you're looking at here at Augusta Health.
Basically we try to develop a care plan, again, with all those disciplines in mind. This is what we're going to do for surgery. This is the timing. Do we do the surgery first and then do the chemotherapy, or do we do the chemotherapy, maybe shrink it, and then we'll have less of an invasive surgery to do if we shrink it at first.
So instead of one doctor, I possibly have a dozen weighing in on my potential care.
Correct. And we do this each and every month, about 3 to 4 times a month.
That's great. And I also understand, first of all, let's circle back and sort of set up Duke's expertise. I believe that, how are they ranked in the nation in terms of cancer research?
They're about number 3 as far as cancer research, and with U.S. News and World Report, I believe they moved up in the rankings this year. I believe they're like 12 or 13. Usually it's kind of goes back and forth with Sloan Kettering and MD Anderson, but Duke's right up there in the top percentile.
So you can be treated right here at home, including you even do radiation therapy right here on campus, and also know that you're getting the world's best in weighing in on your care.
Yeah, they definitely do weigh in, and they may even say we offer some research here, but they've got a much more expansive armamentarium of clinical trials down there. So they may say, well, this is one that we may want to consider for your patient, and we could then offer that to the patient. So I know we've had quite a few that we actually came from Bath County that were able to enroll into a clinical trial down at Duke.
Gotcha. And you also have now hired your second cancer navigator. We've met with Meg and practically have a relationship with Meg on television. But tell us about this second cancer navigator.
Sure. Well, as you know, navigation really is helping that patient and the family navigate their way through the medical maze. And there's, which appointment do I schedule next? After I have this appointment, what's the next step? Do I need to go here, or do I need to go there? And they really do help guide. They help listen, because oftentimes, just like Meg sits in there and takes notes with the cancer surgeon going over the breast, this person will take notes with the pulmonologist or with the GI doc. So she's going to be mainly focused on lung cancer and GI cancers. And again, having that second ears and eyes kind of listening and reviewing things, and then giving those notes over to the patient so they have that at their disposal when they're done with the visit.
Well, it's got to be a great time to lead cancer care here at Augusta Health with having so many new tools in the toolbox.
It really is. Having this, Duke being kind of our consultant and weighing in, giving us that much more breadth and depth than we've had before. We've got great folks here, but then again, when you've got 100 different diseases that you call cancer, you can't be good at everything. So having that relationship to kind of count on. And then we really do have a number of resources, supportive care resources here in the Cancer Center, all under one roof, whether it be the 2 navigators, social workers, dietitians. We have a financial counselor, we have a pharmacist, an oncology pharmacist on staff right here in the Cancer Center. So we have a lot of elements that can all come into play and help the patient and family really get through this very difficult time.
Well, thank you, Brad. It's also got to be really a de-stressor for people to be able to have care really close to home. Thank you so much.
Thank you.
Your Health Matters, brought to you by Augusta Health.
My name is Sandy, and in the fall of 2009, I was diagnosed with breast cancer. I met Meg during my second biopsy. She's the breast navigator for Augusta Health. It's huge to have someone not only guiding the course of your care and helping you make informed decisions about your treatment, but someone who understands what you're going through and understands what you're feeling.
Augusta Health, nationally recognized quality, community-focused care.